Hi, my name is Dr. Cheryl Burdette, and I'm the Educational Director for Origins Incubator. And today in our clinical curriculum, we talked about a case of bloating and gut-related events. And so often when we look at a patient, the first steps are not really the hard ones. We know it's the place to get started, but it's those follow-ups when things aren't responding like they should. So in Origins Incubator, we all meet every week. We bring our cases, and when we see these more difficult cases, we have a place to go. We have a community to draw from. So when we dug into this patient, what we learned is that yes, she did have some positives in terms of gut-based bacteria, even looking at things like Clostridia that could explain the bloating. But she did a very aggressive treatment in that direction. And there was no change. So if there was no change, what else could be going on? Well, it turns out that she does report there's been a lot of stress recently, and she's refusing to see a therapist, and she's got some clues in her background about what's going on. So one of the great things about collaboration is, for example, working with my partner, Dr. Linda Mattioli, who had a wait list after 6 months and is sharing all of that knowledge. And every tool she put together for her practice, she shares in Origins Incubator, as I do as well. And so one of the things we walked through was her handout in terms of what to do when trauma becomes the obstacle. And so walking through various apps that are out there, a nice collection of books for people to read, reasons why we encourage utilizing a therapist, places for you to put your own referrals for that. So rather than having to dig around and figure out, okay, what apps out there are the best, what kind of stress reduction techniques, really kind of giving you here are the things that in our experience rise to the top. And so now instead of being this exhaustive search, you have this background to draw from, this community to draw from of things that we have seen work. So getting familiar with a group of them. And so we walked through some ideas based on that piece of it. So when we decided the bloating was likely to be more of an anxiety event, as gut-based issues often can be, we talked about various probiotics that can improve neurotransmitters like GABA, but we also noted some low thyroid function, which could be contributing as well. Of course, better thyroid is going to mean better peristalsis, so thinking about that too. If there's an element of both stress, as well as low thyroid, well, that's a great indication for ashwagandha because that botanical not only makes us more resistant to stress, but it has some very good data in terms of improving serum T4 and T3 while normalizing TSH. Given her history of being on SSRIs, things that modulate serotonin, but with no improvement, we talked about what other neurotransmitters could be at play, like GABA, and what we might do about it. And then our next steps. She's got bloating. She didn't respond. There were some other positives. So maybe presumptively now going through candida because she'd been on some antibiotics that could have caused that to flare. And if no improvement is seen with that, then we know our next steps need to be probably something like a follow-up stool test or even a SIBO test to see where that bloating is coming from, since the things that were positive on our organic acid test did not result in the outcomes we would suspect. So it's a great place. We come together, we're constantly sharing handouts and tools and references, and it really just speeds up the process in terms of getting to your comfort level of seeing patients. You're not out there all alone searching through every resource, but you've got some go-to things that other colleagues, clinicians have utilized, have seen work, giving you that confidence to really to communicate that with the patient so that they have next steps to take. We know that stress can be one of the biggest obstacles to getting well, but how to guide somebody through that can be difficult without the proper tools. So community gives us those tools to understand what is working, what's not, and best options for our patient. And this is what we do every week in our clinical curriculum. And I would love to see you there and talk about your patients and your cases as well.